Stroke is the leading cause of disability worldwide. Here in Canada, there are an estimated 50,000 strokes each year. But research is underway here at the University of Calgary to try and reduce that amount of disability. Here to tell us about this research is stroke neurologist Dr. Sheila Coots. Good morning to you, Dr. Coots. Thank you for coming in.
Hello.
Well, why don't we start with the beginning and sort of what is a stroke?
Yeah, so a stroke is basically a part of the brain doesn't work properly, usually because of a blood clot in a blood vessel, occasionally due to some bleeding. But essentially that part of the brain doesn't work.
And why is it the leading cause of disability then?
Because the part of the brain that doesn't work does something. So it might be speaking, it might be moving one side of your body, and then if that part of the brain doesn't exist anymore, you can't do that function very well.
Right, quite obviously. Okay. So why is the timing of treatment then so critical? What can you do for these patients?
Well, we have to open up the blood vessel as soon as possible. We lose 1.9 million neurons per minute.
Per minute?
Per minute.
Wow.
And so time is everything. The phrase we use is time is brain, and it literally is, and so every minute counts.
Wow. Which leads us to some interesting research that you've got underway. 2 studies really to talk about this morning. Let's start with the ESCAPE trial.
Yeah, so the ESCAPE trial was run out of Calgary, and it was an international trial, and it basically showed that in big strokes, who have a big blood vessel block within the brain, if you literally suck out the clot quickly, we can save brain and save lives.
Wow. And timing, of course, is critical there as well.
Yeah, at every stage. And so there's the identification of stroke, which we do education every year to try and teach people about what a stroke is. There's then the paramedics getting them to the hospital. There's then everything when you hit the hospital.
Right, okay. So everybody, so a big team effort.
Big team effort.
Wow, amazing. Okay, now you specifically are doing some really interesting work about minor strokes, because we often think of those really big strokes, but there are so many minor strokes, aren't there?
Yeah, so over half of the strokes we see are relatively minor. So this is, we all think about somebody who has a big stroke, so they can't move one side of the body, they can't speak. But in a minor one, you have much less symptoms. Maybe your hand is a little bit weak, or you have a little bit of trouble getting your words out. And so the problem with those strokes is sometimes people are delayed identifying them. They're like,
sure,
I'm not sure what's going on.
I just feel a bit weird today, yeah.
And so, we don't want that to happen. We want people to come in quickly. But then when they come into hospital, physicians have a difficult decision to do, which is, do I treat this patient with a potential medication that might help them? But what is the risk here? And
sure.
We're giving people clot-busting drugs, and that has a risk of bleeding, which could be very bad.
Sure.
But obviously we want to do it better. And we do know that the minor strokes have a lot more disability than we think.
Oh, is that right? So even these minor strokes can cause disability down the road?
Yeah. Mostly we're not talking about going to a nursing home or that sort of thing, but
right.
We're talking about chronic minor disability where there was something you could do before you can't now do. So depending what that is, that could be work, it could be driving.
Right.
That could really affect your life.
Absolutely.
And so we've identified that patients who have a blocked blood vessel within their brain in this minor population that we can easily see on a CT scan are at much higher risk of disability.
Okay.
So we're now doing a clinical trial, randomizing patients to either treatment with a clot-busting drug or just standard treatment, which is aspirin or drugs like aspirin. And so it's trying to find a balance here between making people better but not making them worse.
Right, right, which is a tricky spot, isn't it? It really is tricky. So then would the idea be then to come up with a protocol for everybody so everybody knows what to do in what case?
Yes, absolutely. And one of the first stages is everybody getting the appropriate imaging.
Right.
And so that's changing across Canada, having access to appropriate CT scans 24/7. It's gradually changing. In Calgary we have it,
yes.
But we're trying to move that out
across the board.
places.
Wonderful. Fascinating research, Dr. Coots. Now, if people want to learn more about strokes, you actually have an event coming up here on Friday. It's called Save Your Brain, and it's at the Central Library. They'll be talking all about stroke, basically what you need to know about stroke at the Central Library on Friday night at 6:30. Dr. Coots, thank you so much for this fantastic information. Stroke Month and lots to learn. Thank you so much. All right.